representative of the industry that are participating today might want to talk about their own initiatives. So you have, I'll be discussing those individually as we go today. We have enforced breaks in play, which bring pauses in the play session. Automatic display of informative messages, which consists is pop-up messages interrupting play to deliver content, or it could be also static messages that provide some informative messages to the player. You have limit settings of duration and spending. For this strategy allow online and electronic gaming machine players to automatically set time and spending limits, supported by reminders and or animation videos. I was referring to, this refers to these pop-up messages earlier. Another strategy are behavioral tracking tools, which uses administrative data sets identifying behavioral markers to profile gamblers as behavioral changes that may indicate problematic practices and offer, when necessary, personalized feedback or track subsequent intervention by trained employees. So you have behavioral tracking tools that can be added to other initiatives as well that I'll be discussing today. Self-exclusion programs offer the possibility for gamblers to adhere to a program that excludes them from a gambling venue or website. Staff training to respond to problem gambling will provide the necessary information to help employees better identify and respond to signs of problem gambling and related distress. And also research has studied promotion and marketing of responsible gambling, such as populational campaigns, youth programs, for example. So today I'll be discussing the impact of each of these initiatives on changing behavior or correcting erroneous conditions and other impact we might have. In regards to enforced breaks in play, it does not seem to contribute to reducing harm, at least on its own. Breaks and all may have unintended effects, such as increasing cravings leading to a continued play. For example, an Australian study with students have shown that imposed breaks in play may have the opposite effects. We have yet to know what would be the optimal length of play, and the breaks in play do not studies on breaks in play do not account for individuals enforced breaks in play do not take into account the variety in gambling practices, nor the differences between the different games, and it makes it a little harder to study as well. The next strategy is automatic display of informative messages. It has shown to be effective in supporting self-awareness and self-control, and to confidence and erroneous cognitions. It seems that the frequency of the display, the positioning of the display of these messages in the screen, and the presence of animation, as well as the color of display, have an impact on recalling the message and short-term behavior change. Some recommendation has been made to improve such messages, such as including self-appraisal messages, personalized normative feedback, or time and money reminders. However, the evidence in the scientific literature has yet to determine whether it is the message itself or the break in the play that it provides, or the combination of both that contribute to reducing the risk. Is it the instructive component of the messages, the self-appraisal that it offers, or both parts that can contribute to the message itself, or to the message and the impact it has on the behavior? And we have yet to know what is the optimal frequency of receiving those messages when someone is gambling. And this is an example of Gainsbury research of different forms of messages that could be presented. And some are more informative messages, and others invite the gambler to self-appraise his own gambling practice. The research has shown that greater recall of messages there's a greater recall of the messages when self-appraisal has been solicited. However, there's limited impact on change in behavior. Moving on to the limit settings and duration and spending. So limit settings allow online or electronic gaming machine players to automatically set time and spending limits. For example, we can think of imposing deposit limits, receiving notifications about these limits, changing or resetting the limits, and the player receiving an overview of his account and history. These limits are often supported by reminders or animation videos, as discussed previously, and have shown to support to support responsible gambling. It is especially effective if prompted before engaging in a gambling session. If the limits are being set by the gamblers themselves as opposed to determined by the operator, and the format in which these limit settings are provided, or the content or the dimension that are being set, is important. For example, focusing on winning limits and adding novel features such as the interaction between the player and the machine can increase their impact on the player practice and way of thinking about game. Problem gamblers are less likely to adhere to these limit settings. Gamblers who reach their limit may simply switch to a different machine or online venue. It is also possible that the time limits may lead gamblers to bet larger sums to compensate for shorter sessions. And finally, it is unclear if limits work when there's a high level of arousal. Yeah, sorry for my English. Some limitations in the research have been identified, giving the methodological limitations such as accounting for gamblers switching gambling platforms or machine. The current evidence does not confirm the effectiveness as a preventive tool. Authors even refer to adverse effects where gamblers would bet sums to compensate for shorter sessions, as I've discussed previously. So far we need further research to have a very good understanding of how these limits might have an impact on the gambler's practice. So this is an example from Loto Quebec that shows a kind of a limitation, information, pop-up information, or this is the more static information that is provided on the online website, online gambling site. In terms of behavioral tracking tools, so as I said, this information, the information on gambling practices are extracted from administrative data set on gambling activities. So far, such tools have shown some positive but small and short-term effect on behavior change. If they are combined, for example, with pop-up messages or providing more personalized normative feedback based on these tracking tools, based on the analysis of the behavior of players online, for example. There are also other ways that have been used to track player behavior. For example, the analysis of emails to consumer services may be one of the ways to track at-risk gamblers. Also, social media may offer opportunities to promote responsible gambling. There's one example where social media has been used by operators to keep in touch with gamblers, but it is seldom used to track behavior. Although we have the opportunity, if I can make a side comment, with artificial intelligence to track social media interactions and provide more personalized feedback. We can discuss this further at the end. One study even has used automatic English and German text analysis of emails to customer services of an online operator as a way to identify cases in need of attention. And that's one example that was published in 2015, which is really interesting to go into further details eventually. So behavioral tracking tools has some small and provide small and short-term behavior change. At-risk players who are receiving feedback will reduce the amount of money deposited, for example, and this in one research has been shown to be sustained 24 weeks later. It remains, however, unclear which element of these tools can be effective and how they can be combined with other strategies to make them even more effective. Some recommendation is using these tools to provide personalized feedback to gamblers, and that these tools are more effective. Tracking tools and messages that can be defined afterwards are more effective for those that are at risk than for those who have problem gambling. The use of the tracking tools are good in providing information to develop preventive messages rather than using them as an intervention with problem gamblers. It remains also unclear how to provide a good measurement based on the tools, how to combine administrative data with real or validated tools to measure the severity of the gambling, and also what type of information is being recorded and in which context, and how they're being used in a different context. That might create it might add a difficulty in interpreting the data that we have if they are just based on administrative information. So the next strategy that I would like to discuss is the self-exclusion programs. There are different motivations that gamblers have used to subscribe to such programs, such as wanting to commit self-control or stop gambling overall, needing help or hitting rock bottom, or stopping a threat for personal consequences or other people close that are close to them. Participants to self-exclusion programs can quit gambling to all forms or only from certain activities or venue. Self-excluders sometimes adhere to the program early on or in a serial manner after breaks or breaches. Potential benefits of self-exclusion programs, especially in the short term, has been found. They can contribute to the reduction in gambling expenditure and improvements in financial situations, the reduction in gambling frequency and duration, although this has yet to be observed for online gambling. Evidence have also shown the potential to help decrease permanent gambling severity and other psychological difficulties, but for example, some may feel in greater control of their gambling and may make a commitment to stopping gambling overall. The multiple breaches identified in self-exclusion programs, however, is a testimony of their limits in their efficacy and reinforcement, especially if reinforced by support, especially if it's not reinforced by the support of trained counselors. And research on self-exclusion programs have shown difficulties in identifying potential breaches, especially since the patron can gamble at other venues or where they are not excluded. And also, there's been some gap identified in staff's ability to identify or respond correctly to self-excluders. Some other barriers inherent to the self-exclusion program have been highlighted in the literature. For example, the need for adequate language to understand the contract, the possibility to register on gambling sites, and also the absence of trained professionals, as I've said just a little earlier. Self-exclusion programs could be improved by providing clear information on the program and having those programs being accessible on-site or even outside of gambling venues. In addition, offering support from trained professionals will help improve these programs. And some other recommendation has been made in regards to excluding patrons that have a contract of self-exclusion from promotional materials, from credit and loyalty programs, as well as from mailing lists related to gambling. Some recommended best practices have been put forth, For example, allowing reinstatement of high-risk gamblers who have benefited from self-exclusion programs should be done upon an active request by the gambler and should be followed by voluntary meetings with responsible gambling staff to define a safe agreement, as well as to adhere to other conditions such as limiting access to credit and loyalty programs, limiting exposure to marketing. Some conditions may need to be more strongly reinforced depending on the presence of breaches during the program. In addition, possibilities for renewal or extension of self-excluded gamblers should, however, remain a possibility for those who wish to do so, and should be requested via telephone, mail, or in person in other locations than a gambling venue. In regards to the self-exclusion programs, there is no evidence to support revocation of gamblers who have regained control, and according to experts and key gambling stakeholders, such a strategy may present a risk for a population that is vulnerable. It should therefore not be used as a best practice in self-exclusion programs. Finally, in regard to staff training to responsible problem gambling, little research is available on the effectiveness of such training in reaching their goal, but they have shown promising results. Training of gambling retailers, staff, and casino employees offer information to facilitate the identification and response to signs of problem gambling and related distress. Staff training workshops with VLT retailers in Quebec have shown, for example, to contribute to an increase in understanding of problem gambling and symptoms by the staff, and increased capacity in coping with excessive gamblers and in selecting the optimal moment to intervene. Compared to staff who did not attend the workshop, those who did will have more often approached a problem gambler and have discussed potential support options. In an but questioned the effectiveness to respond adequately. And there's also a French-speaking Swiss VLT operator study that stated fear of staff in regards to players' negative response have prevented them from intervening and approaching the gamblers. So there seems to be a need for further training in adequate response to problem gambling and in coping strategies with negative feelings expressed by clients seems to be important for the staff. Lastly, studies evaluating the effectiveness of the promotion and marketing of responsible gambling are scattered and limited. And it's a strategy that has had little effect on changing behavior. According to results from a large study of online casino and poker players from 96 countries, responsible gambling tools are all perceived positively. So this is a good and interesting results. However, results from the experimental Australian study also highlights that integrating messages on the social consequences rather than the material consequences in responsible gambling advertisements were more effective in reducing the propensity to gamble, in particular when presented as losses and among problem gamblers. One Quebec study has also demonstrated that on-site casino information centers can contribute to modify misconception about randomness, even after 3 months, in seniors, occasional slot machine players, and non-problem gamblers. However, these on-site information booths do not contribute to behavioral change, and I don't think that should be expected either, but that's my personal opinion. There's another recommendation in regards to such promotional messages is to capture emotions in the messages, such as emotional context, such as the familial impact or long-term financial impact that problem gambling may have. And such messages may capture the public, may have a better chance of capturing the public attention. However, many methodological limitations were highlighted in studies of responsible gambling promotion. such as short follow-up periods, having no time zero to measure the change, limitation in measuring problem gambling, as well as I've discussed earlier. How can we actually measure harm, and do we measure different forms of harm as well? So to conclude, and before we move to the discussion, overall, there are some methodological shortfalls in research on responsible gambling. Empirical research regarding responsible gambling is limited, and the evidence provided for certain strategies are inconclusive and present important methodological limitations. Although laboratory experiments or ecologically valid experimentation allow to isolate contributing factors, they however do not necessarily carry out in the real gambling environment, therefore lacking ecological validity. And those in this context tend to focus on excessive gamblers with little results for moderate risk and low or non-problem gamblers. To improve responsible gambling strategies, we need a clearer understanding of how each tool and strategy are used and have an impact on different gambling patterns and gambling problem severity, including comparing users from non-users of such strategies. Some programs and tools have received more attention, such as voluntary self-exclusion programs or pop-up messaging. Notwithstanding their contribution to sustaining excessive play, technological innovations have also encouraged the development of responsible gambling tools, such as breaks in play, the messages, limit settings, and behavioral tracking. So we have a conundrum here where technology helps to track behavior and respond to the problem gambling, but also may contribute to it. Responsible gambling experts, treatment providers, and recovered problem gamblers agree that responsible gambling strategies would vary according to structural characteristics of a game, with an online gambling providing more possibilities. So we need to account for the differences in gambling, not only gambling patterns to each individual gamblers, but also gambling patterns that each type of gambling provides or may enforce. So overall, the extent of our knowledge on problem gambling is substantially good. However, Binde would argue that the state of evidence on how to prevent it needs improvement. Research on responsible gambling would benefit from longitudinal studies, allowing for the evaluation of the effectiveness of various tools. Also, research on gambling research on responsible gambling is in need of clear definition of what is actually being measured. Is it the knowledge, the reported skills, the attitude? We are in need of large enough sample, the inclusion of a control group when possible, the use of follow-up messages, and also in-depth qualitative study to understand better the processes and the meaning and context of and the experience of gambling itself. The promotion of a culture of responsible gambling would benefit from a collaborative approach between governments, the industry, and gamblers. There's an argument that the convergence in regulations and regular monitoring may further help implementation of responsible gambling strategies. For example, the British example shows how the tension persists between the state, the regulator, and the gambling industry and the consumer, poses a challenge in the implementation of regulation that can both protect the public and respond to the liberal market economy. Finally, although new technological developments appear to have facilitated the development of responsible gambling tools, such as behavioral tracking, operators need to be cautious about the accuracy of models that are used to detect problematic play. As I've said earlier, data mining can be a powerful tool, but we need to be cautious to what is the meaning of the data that we are actually gathering, and in which context it has been gathered, and how we are using it. With the changing of the field or the offer of gambling, and I've added here Kerou's presentation at Agri this year about the gamification of gambling and the gamification of gaming, we see that the field of gambling is changing. which will require adjustments in our regulations, policy, and interventions if we want to keep up. And I think that's one of the biggest challenges is the offer is changing so quickly that it becomes more and more difficult to adjust because research takes a very long time. And once we get the funding, I think the purchase has already changed. So that's a challenge for us researchers in this regard. So on this last note, word of advice, I would like to open the floor for discussion and maybe have further input from our experts and other participants who want to add to the exchange and to the knowledge that has been shared today. Thank you.
Thank you very much, Chantal. And as she said, we can move into some questions and discussion. So like I mentioned at the beginning of the webinar, there is a raise hand function built into WebEx. So if you virtually raise your hand, I can unmute your mic. And then I would ask that you are careful to de-raise your hand afterward. Otherwise, it looks like you're still in need of some unmuting. And so while people sort of ponder on their questions and thoughts, I actually have one from you from an attendee named Chelsea. And she's wondering about the physical benefits of taking breaks in play. So you talked about that as a responsible gambling program or tool. And she wonders if there's literature around the physical benefits, like standing and stretching and taking a bathroom break, and how those in and of themselves can be beneficial.
That's a very interesting question that I haven't come across it. I don't think it's because it does not exist. I remember a research, I'm trying to think of her name. It was an anthropologist who did a study on VLT and slot machine players, and the physical harm itself was highlighted by the players, and it became a problem, and as also kind of an indicator of excessive play, if we can say, to some extent. But maybe someone in the audience would have an answer to that.
Does anybody have any insight into that from their own work? I'm not seeing any hands being raised. Also, a reminder, if you do not have a microphone, which I know is a concern for some, I can moderate via the chat function in WebEx. But Chantal, you might be off the hook. I'll give one sort of last call. And otherwise...
yes, maybe the author was referring to is Scholl, Addiction by Design. For in regards to the physical, well, not physical benefits, but at least the physical harm that can, excessive they can have. Yeah.
Great. So Chantal has posted a little image and link to the white paper that she prepared for us at GRIO. That is hosted on our Evidence Center. Oh, I actually have a question from Olive. What can be said about the effectiveness of the red flags used by casino staff to monitor patrons?
Can she elaborate on the red flags?
Olive, I think you probably heard that. So I imagine the sort of signs that the casino staff are looking for and how effective that approach is.
I think without training, well, there's two things, two conditions that are needed for this, from what I understand from the literature. One is to have staff training. If the staff is not trained on how to identify a problem gambler or excessive play or problematic play without being a problem gambler necessarily, the flagging becomes difficult. And there's also a way we need to know how to track these players. You have these fidelity cards that could be one. The exclusion programs also that provides, for example, I know in Quebec you have the picture, the license plate, other descriptions that can be used to track a player, so that can help identify a player. So I think you need, for it to be effective, you need a combination of strategies to be able to intervene, because just flagging is not necessarily sufficient. Why flag if you're not there to intervene? But that's a public health promotion health prevention approach. So you cannot test someone if you're not ready to, if you don't have the resources or the service to support that person. So I think you need to have the program behind it to support anyone that you want to flag.
Okay, thank you. Olive, if you have follow-up questions, feel free to send them. But in the meantime, as I was saying, the link to the white paper is at the bottom of the slide that's on the screen right now. You're able to search that yourself in the GRIO Evidence Center, but Chantal has also offered to share her slides. So this webinar has been recorded if you'd like to share with some of your colleagues or stakeholders. And I will send out a copy of the recording with a copy of these slides to you sometime either late this week or early next week, so you'll be able to have that as a resource. And if I don't have any more questions, which I do not see, then I'm just going to say thank you very much to all of you who attended the webinar today, and thank you especially to Chantal for preparing this information for us.
Thank you.
We do have one more question from
Yes.
Olive. Chantal, if you have one more moment.
Sure.
She wants to know what sites can someone self-exclude at in addition to a casino. Does that make sense? So if someone's sort of having problematic
online sites, or is that?
Yeah, I mean, she would perhaps have to specify, but if you, so because we know you can gamble inside a casino, or you can participate in gambling like within your community at the local corner store, anything like that. I guess where can self-exclusion apply outside of the casino?
From what I know, and I'm not the expert in self-exclusion programs, so casino, you would have a written contract with the casino. You have online sites that also offer, some online sites that offer these possibilities. And I would have to refer you to a report that was produced in Quebec where they did an overview of gambling strategies in online. They might have the information there, but I don't know about more privately owned or venues, how they would work that. In Quebec, for example, staff in bars and pubs have been trained to identify, but maybe they could have in that situation, and I'm speculating here, they could have the possibility of excluding or having an exclusion program with the bar owner, but I don't know to what extent they would agree to that, in the sense that they also make money out of the slot machines, of the ATM machines that they have, of the machines they have in their bar. So I don't know how that would work out, how open they would be.
We have a couple people tuning in. Jessica Tanner says that patrons can self-exclude from bingo halls. We do have a representative from OLG who's signed on, who's willing to explain how that might work in Ontario. So I will unmute her in a moment.
Perfect.
And then Bev from Manitoba has also said that self-exclusion is available for online gaming and casinos in Manitoba, not for VLT sites or lottery retailers.
Okay.
So I am going to unmute Sarah. If I just have to find her first so that she can explain how that plays out in Ontario. Oh, Sarah's actually not connected right now, so perhaps I will not.
Okay, well, until she comes back, there's also probably some helpline or self-help groups that could be found online, and maybe with them there's a possibility of creating kind of a safety net around the certain gambling practices, and help a gambler to contain the excessive gambling. That could be a possibility. I don't know if they offer that. I haven't searched in that direction, but that could be a good entry door to see if outside of casinos or bingo halls, there could be an option there to help.
So I have, let's see, Sarah says, self-exclusion is from all gaming sites and all C gaming sites, and from Play OLG, depending on the line of business, you self-exclude from. And Olive has one more follow-up question, then I think I will probably close questions after that, and she wants to know if there are any liability issues with self-exclusion. Is that enough?
I would ask the industry representative online today to answer that one. I have no idea. Okay.
So to Olive, I can connect you with Sarah from OLG to follow up with that question if you would like. Just send me an email. And otherwise, Chantal's email is on this final slide. I will send the slide deck along with the recording along to you all in the next week or so. And again, I'd like to thank all of you for coming and to Chantal for presenting for us today. Thanks a lot, everyone.
Thank you.